Good morning, everyone. My name is Maurizio Gioda, and today I will be talking to you about the therapeutic application of ultrasound in conjunction with cold and heat. As I said, I am Maurizio Gioda. I am a sports scientist, physiotherapist, and osteopath, and I have many years' experience teaching at university and osteopathy school. I am also a specialist in ultrasound, laser, and other electric current-based therapies. Let's start with a brief overview of the most recent literature. If we type therapeutic ultrasound into the PubMed search engine and restrict the results to reviews from the last 5 years, we find that there are about 3,600 articles. Ultrasound is obviously an established technology, as we have known about it since around 1950. Today's ultrasound is, of course, much more technologically advanced, but the methodology has been proven by various pieces of scientific evidence in the literature. I will mention one interesting article that I found, a 2022 review comparing the effectiveness of traditional ultrasound at 1 or 3 MHz, which has poorer tissue penetration compared to shock waves. Interestingly, this review concludes that there is no significant evidence of a difference between traditional ultrasound and shock waves. Therefore, further studies are needed to verify and evaluate where ultrasound is more effective and where shock waves are more effective. In this short report, however, I will try to clarify some concepts and help you make the right choice. Firstly, when discussing inflammation, it is important to remember that there are 3 types: acute, subacute, and chronic. Although this is true, this differentiation is in terms of time. For example, if I experience trauma or acute inflammation, this inflammation will become chronic within a week or 15 days, obviously passing through a subacute phase. The true characteristic and real difference between acute and chronic inflammation is biochemical and biological. In the acute phase, certain molecules are present, such as valdecyclins, prostaglandins, serotonin, and so on, which are secreted by all tissues. For nerves, instead, we will have, in particular, other molecules such as neurochilin, substance P, etc. In this phase, there is significant vasodilation supported by molecules such as serotonin and histamine. As a result, there is an increase in heat and redness. In the chronic phase, these molecules are no longer present. There is basically an accumulation of catabolites from the initial inflammatory phase, mainly oxygen-related species, as well as nitric oxide and various free radicals. Obviously, in an acidic environment and an ischemic condition, there will be minimal tissue damage and tissue suffering, resulting in neurogenic pain with more nociceptors involved and a change in the activation threshold. There are 2 fundamentally different phases, with a central subacute phase where these characteristics are mixed to some extent. But why am I talking about this? Firstly, I would like to discuss an important topic: heat and cold therapy, or cryotherapy, which is the exogenous application of heat and cold for therapeutic purposes. Although it is now well established, we often find few articles in the literature that clarify the use and timing of heat and cold, beyond somewhat imaginative accounts and empirical observations linked to various experiences. We are all familiar with patients arriving and saying things like, "They told me to put ice on it because I got kicked in the knee," or "I put it on and kept it on all night. Now it's all red and I'm burned." These are the consequences of the incorrect application of heat and cold. If used incorrectly, they can cause damage. As I said, we must always consider the temperature and treatment time, because combining inappropriate temperatures and times can lead to undesirable effects. So, what possibilities do we have when working with QMD's ultrasound cryothermal? Firstly, We can work with a cold effect ranging from -2 to 15 degrees and a hot thermal effect ranging from 30 to 42 degrees. Then there are two other applications, two pre-configured protocols. One of these is thermal shock, which involves a drop of about 30 degrees over 45 seconds. The purpose of thermal shock is to create local anesthesia in areas that are extremely painful and therefore difficult to treat. This allows us to anesthetize the patient and provide momentary relief, enabling us to apply manual therapy or infiltrative therapy if we are orthopedic surgeons, physiatrists, or other specialists who need to perform more invasive operations. Finally, contrast therapy involves alternating cycles of heat and cold or cold and heat, depending on whether we are treating an acute or chronic condition. Now, let's go into a little more detail. The cold function, or cryotherapy, typically recommends a temperature of around 0 degrees Celsius. Temperatures below these are not recommended, as there is always a risk of cell damage or minor burns. Therefore, we recommend sessions of less than 5 minutes. This results in a predominantly vasoconstrictive and anti-inflammatory effect, which is specific to the acute phase and analgesia. The recommended temperature for the thermal effect is around 38-40 degrees Celsius. In this case, there are no time limits. For example, we can safely walk for half an hour at 40 degrees Celsius because it is below 45 degrees Celsius, so there is no risk of burning the patient with excessive heat. What is it basically used? It has a predominantly vasodilating action and therefore a muscle relaxant effect. This makes it ideal for treating chronic conditions and degenerative and chronic degenerative pathologies involving an important acidotic ischemic component. It increases oxygenation, reduces hypoxia, and increases trophism through tissue nourishment. As I said, thermal shock is specific to this significant drop of 30 degrees Celsius in 45 seconds. It is used to reduce sensitivity and therefore has a momentary analgesic, antalgic, and anesthetic effect. It is used in situations where the segment to be treated is too painful, preventing effective treatment as the patient stiffens due to pain. This is also very useful if we need to use it before stronger, more painful therapies such as shockwave therapy. Contrast therapy involves alternating hot and cold cycles, similar to knife therapy. Its effectiveness has been widely confirmed in clinical studies and literature. It has various effects including draining, relaxing, anti-inflammatory, and analgesic properties, making it extremely useful. The important thing when using contrast therapy is to start with heat and end with cold in the acute phase, and vice versa in the chronic phase, start with cold and end with heat to have a muscle relaxant action. Again, we must end with heat, and for anything related to pain or digestion, we will obviously end with cold. The duration depends greatly on whether the pain is joint or muscle pain. If it is joint pain, the duration is slightly reduced. Well, we have made a very simple introduction at explaining the methodology of treatment with heat and cold, but now let's go back to the methodology of working with ultrasound. As we have already mentioned, ultrasound is a technology that has been established over the years, over decades, and everyone is familiar with it. What fundamentally differentiates this machine is the possibility of working not only with ultrasound or cryothermal therapy, but also of combining cryothermal therapy with ultrasound. Let us recall the effects of ultrasound. We have sound waves, obviously above 20,000 Hz, above 20 kHz, because ultrasound is distinguished when this frequency is exceeded, and these sound waves, which in our case the head will emit at 1 MHz and divided by 3 MHz, create thermal and mechanical effects. The thermal effects are basically produced by vibrations, by the impact of friction between cellular and intercellular structures, while the mechanical effects are mainly created by acoustic cavitation and therefore the formation and growth of these small gas bubbles that eventually implode inside the fluid. Thermal effects are obtained with continuous delivery, that is to say when the ultrasound is always on, whereas mechanical effects are obtained with pulse delivery, that is to say with an on divided by off cycle that can be adjusted to be very pulsed or pulsed but almost continuous. The two effects are not independent, as kinetic energy dissipates in the form of heat and tissue impedance varies in relation to temperature. We have already mentioned that the heads deliver at 1 or 3 megahertz. 1 megahertz is a deeper frequency than 3 megahertz, so the mode can be continuous or pulsed. We also have the option of choosing two special programs, Think 1 and Think 2, which alternate between 1 and 3 megahertz frequencies. This is mainly used to achieve good muscle relaxation, and ultimately we should remember the combination with cryotherapy or thermotherapy. We have already mentioned that the heads deliver at 1 or 3 megahertz. 1 megahertz is a deeper frequency than 3 megahertz, so the mode can be continuous or pulsed. We also have the option of choosing two special programs, Think 1 and Think 2, which alternate between 1 and 3 megahertz frequencies. This is mainly used to achieve good muscle relaxation, and ultimately we should remember the combination with cryotherapy or thermotherapy. So what are the characteristics of combining heat or cold? First of all, it is possible to combine cold with ultrasound, allowing the handpiece to simultaneously deliver an ultrasound signal of either 1 or 3 megahertz in combination with a cold temperature. This is possible thanks to what I did not explain earlier, which are Peltier cells. This is the technological method used to create heat and cold, and therefore on the same handpiece we can deliver an ultrasound signal and a cold signal, obviously a cold contact. Why do we need this? It allows us to increase the output, thus increasing the intensity in terms of watts expressed by the ultrasound, and therefore increasing the penetration of the signal without, however, incurring what could be excessive heating and therefore also pain elicited by the patient. The combination with heat, on the other hand, allows me to improve the specific therapeutic effects for chronic and therefore chronic degenerative pathologies such as arthritic conditions or conditions of severe muscle contracture linked to pathology or muscle contracture, perhaps due to sports fatigue or general muscle fatigue. And this allows me to achieve tissue relaxation, an important muscle relaxing effect, and to be more effective by increasing the hyperemia of the tissue to be treated. Obviously, this type of treatment is not recommended in all cases of acute inflammation, post-surgery, post-acute or post-traumatic conditions, which obviously fall into the treatment phase where cold is preferred. So, what are the main advantages of this device? As I said, we are not talking about two separate devices, one for heat and cold therapy and one for ultrasound therapy, but a combination of ultrasound with heat and cold. So we can also combine ultrasound with contrast therapy and thus have alternating cycles of heat and cold combined with ultrasound, which would allow us, for example, to emulsify large molecules and reabsorb them by alternating between vasodilation and vasoconstriction. In this case, therefore, this treatment becomes important for all types of edema, whether post-traumatic or post-surgical, any type of edema and hematoma, and we therefore have an important draining and anti-inflammatory action. So to conclude with the slides, what are the fields of application of ultrasound? The fields of application of ultrasound are now well known, certainly everything related to bone repair, fractures, injuries, etc. But also, of course, those that may be spongy edema, that is to say, all traumatic and non-traumatic bone injuries, sometimes even non-traumatic ones. The repair of tendon injuries. The literature is increasingly demonstrating how ultrasound is effective in the treatment of tendon problems, especially because we often deal with tendinosis, not tendinitis. In other words, chronic conditions where it is necessary to provide not only mechanical but also thermal stimulation in order to reduce hypoxia and restore oxygenation and nutrient supply to the tissue. Treatment of scar tissue. Yes, of course, the scar tissue must be completely closed and modeled, so I need it at a later stage when the scar has healed, and this accelerates the treatment, slightly increasing the elasticity of the tissue and restoring as much as possible the condition of the fibrous tissue attached to the scar. Certainly, the reduction of swelling, therefore the treatment of edema, everything that is an initial phase, even in anti-inflammatory, where there is exudate, therefore there is edema. Ultrasound combined with cold, alternating hot and cold, is very beneficial, relieving all joint and muscle pain, precisely because we can have a muscle relaxant action on the muscle and also an analgesic anti-inflammatory action on the joint. So, these are some of the most important fields of application for ultrasound, those in which ultrasound is somewhat of a leader in treatment, certainly, I repeat, bone and edema. Tendons can be treated with both ultrasound and other therapies, always with excellent benefits, but ultrasound has proven to be very effective. Another important pathology where ultrasound is widely used is inflammation, edema, and fibrosis of subcutaneous tissue, the hypodermis, which often suffers particularly badly following trauma and obviously causes pain, with the patient reporting severe pain. In these situations, ultrasound is definitely the treatment of choice. As already mentioned, everything related to muscle treatment, but it has also been seen in the literature that the application of ultrasound with heat is an excellent tool for treating trigger points and therefore myofascial pain, for example. Therefore, I would say that when used in the correct fields of application, ultrasound combined with cryothermal therapy certainly has great benefits for patients. I would like to emphasize how essential this type of combination with cold or heat or alternating heat and cold is in order to increase the effects of ultrasound itself, combining them with the effects of cryothermal therapy, that is heat and cold. However, it is not advisable to use temperatures that are too low and prolonged over time, so when working with temperatures below 5 degrees, I normally recommend working for less than 3 minutes or a maximum of 5 minutes, precisely to avoid causing minor damage to the skin or subcutaneous tissue, whereas with heat we can work for longer periods. I hope I have answered your questions and doubts and been sufficiently comprehensive in this brief explanation, which was intended to introduce you to the world of heat and cold in combination with ultrasound, especially for those who are just starting out on this path and are not yet familiar with ultrasound. With that said, I wish you all the best and good luck with your work. Thank you.